In his update on South Africa's response to the COVID-19 pandemic on Monday, President Cyril Ramaphosa announced that only about 10% of the South African population will have access to the COVAX facility, while countries such as the United Kingdom, USA and Russia are steady on the rollout. It is difficult to predict where South Africa lies, particularly who will be prioritized in the initial doses in the early part of next year. Ramaphosa also said that South Africa was part of the Africa Vaccine Acquisition Task Team, which would look at alternative financing mechanisms to secure additional vaccines for African countries beyond COVAX. Joining us to discuss these latest discoveries and the announcement of access to only 10% of South Africa's population, we're joined by public health medicine specialist Dr. Lehlohonolo Majake. Dr. Lehlohonolo, thank you for your time and thank you so much for joining us on Weekend Dawn. 10%, that seems like a little. How much does 10% actually cover within the greatest context of the numbers in South Africa?
Good morning, Jacob, and thank you for having me. I think before we get to the actual number of 10%, what we need to understand is that the COVID-19 situation is truly a public health emergency of international concern. Globally, we're worried about the fact that we have a virus that is rapidly spreading and has great ability to cause mortality and morbidity. So all decisions that are made from country level are often informed by what has been discussed at WHO. And of course, now we've got the COVAX, which is a facility that is aimed at ensuring that there's going to be equal distribution and access to the vaccine across board. So when we think about the fact that ordinarily it takes quite a while to develop a vaccine, we've had the rare situation where we've had to use vector vaccines or mRNAs to create a vaccine for COVID. And so they're not enough. And also manufacturers could not really commit to making exorbitant amounts of the vaccine because they need to be able to pay for the raw material, pay for the human resources that's going to create it. So what has essentially happened is certain countries, and to date, there's been 80 in the advanced market commitment team that have really said, well, we'll put X amount of money into helping yourselves as manufacturers to create the volumes that we'll need. So the next decision that was made was, well, on average, how much would we need? And it was said 3% is what would be needed to give the healthcare workers enough access. And then 20% is what would ordinarily be given or required to give at least the healthcare workers and those who are vulnerable in a country access. So 10% does rather sound quite low, but it's also based on the fact that by giving in an X amount of money to the COVAX facility through the AMC group, you are essentially guaranteeing yourself a certain number of vaccines. And so the 10% is going to cover the 3% healthcare workers and of course 7% of the vulnerable. Bearing in mind that this is a start. So when South Africa actually said that they're committing towards aiding to the fund, already around about August, it was part of the dialogue. They essentially knew that they would start first with those in need and then gradually increase.
Shall we talk about the money as well? What does a vaccine cost for the average income household or for even the low income earners in South Africa? Is it something that will be administered via medical aid? How will it actually work?
So at this moment in time, because we're responding to a public health emergency of international concern, the markets cannot really favor making it a commodity. What needs to happen now is we need to ensure that those who are at risk receive the vaccine as soon as possible. On your question of what is an average vaccine cost, remember that when we talk about public health, we actually look at common diseases and ailments that happen commonly, that have an ability to cause severe disease and spread. So in South Africa, we've got the EPI, Extended Program on Immunization, which is essentially a free program that's utilized within the country. So those are the ones that yourself, myself, our children, actually have. And of course, we've got additional ones where, of course, based on the fact that we do apply the constitution of everybody having the right to additional choice, there will be additional vaccines that you would pay extra for those who wish to use the private vaccination. But this is the dialogue we're having about health. Health is not about you being able to afford to pay for facilities. And it ought not be something that you have to exorbitantly save money for or shift your resources, financial resources from your household into health. So currently we're looking at the cost of between $1 to $3 if they use the pooling model, which is basically having the countries from the higher income earning group that will be putting in money into the COVAX fund, and then of course having certain amounts of money that will go to the official development assistance group, which is those that are lower income and lower middle income countries. And ordinarily, from what I understood, the vaccine would actually cost about $30 US. So already when we look at pooling system, it does significantly reduce the cost of the vaccine itself. But I love your question about how much does it cost? When we talk about health, when we talk about access to healthcare and equity in healthcare, one should not really talk about budgets. And that's where concepts of universal healthcare coverage come in, and in South Africa is translated into NHI.
And what about people in the rural communities or informal settlements? When you talk about the ones who are prioritized within the 10%, would they be part of that 10% as well?
So spot on. The National Department of Health will still need to decide who it is that's going to get access. But you're absolutely right that when we talk about those who are most vulnerable, health and the social determinants of health, it's dictated by various factors. We talk about the HDI, Human Development Index. Do you have access to education? Do you have access to resources? And then, of course, there's the HDRO report as well that looks at additional factors, like, for example, your water and sanitation and so forth, which basically is the social determinants of health. We know that rural areas are not only ones that don't have state-of-the-art or most modern technology in terms of access to care, but we also know as well that they have to travel far. Often the basic resources of water still tend to be a challenge. So you're absolutely spot on that those would have to be the areas. It would have to be those who are most exposed to COVID, which are healthcare workers. And remember, healthcare workers works both ways. You can have a healthcare worker who gets COVID, who infects somebody else, or you can have a healthcare worker who looks after a patient with COVID and gets infected. So that's why it makes them then vulnerable. And then secondly, those who would then not have your resources or tools to combat your COVID-19, we know it's all about social distancing, so densely populated areas need to be looked into. We know about washing hands, so where there are resources to water and sanitation, absolutely there would be places to look into. And of course, we know about the fact that those who are most in risk are individuals about the age of 65, so those would also fit into that category. I think what is important to also know is this is an incremental approach. So just because we're getting vaccines for 10% of the population at this moment in time does not mean it ends there. I think, like I said, we're dealing with a public health emergency of international concern. We're dealing with a novel virus. We're dealing with all of this in the context of economies really being stretched and strained. So no approach is going to be one that has been pre-planned or regular for that matter. But what is critical is we cannot afford to sit back and have COVID-19 spread unabated. We need to be very responsive, and I think that's what we're doing at this moment in time with the little resources that are available.
Before we let you go, Dr. Lehlohonolo, in 30 seconds, what are your thoughts on this new strain that has been announced by the health minister? Should we be worried, and can this vaccine also cover this new strain?
You know, when I heard about this new strain yesterday, I thought, Jumanji. It really is a conundrum, isn't it? That when finally the global scientific community gets to a point where they can actually have a vaccine that will hopefully help to abate this rapid spread of COVID-19, then we get different ailments, and now we have mutations. And particularly here it's 501Y. And I think, initially one would have thought, okay, it's probably just in the RNA, but now when you realize that it's also in the protein that binds to the receptors, it makes it more difficult. I think what is important, however, is we should not have panic. What remains absolutely critical is, and this is exactly why we're having conversations about beaches being closed and certain tourist attraction spaces being closed. We need to do the social responsible thing to avoid further spread. We've seen that currently it's more in the Nelson Mandela Bay area and also in the Garden Route. We know that we do have institutions that are looking at it, UCT, KZN, and also in the Free State to see just how widely spread has the 501Y virus been. But what is critical is we need to wear our masks. We've seen also in Denmark that recently they had to actually unfortunately cull a lot of minks because they too have had variants. So there's still a lot of studies that are going on. But I must say, I am absolutely proud with the scientific community in South Africa to be able to get to a point where they could pick up on phylogenetic changes so rapidly, especially because nobody had ever planned for this virus. It is critical technologies that are required to make sure that there's ongoing management and mitigation of the virus. But the responsibility still lies on you and I to make sure that we do the right thing when it comes to COVID. Festive season is coming up. Let us be responsible. Let us not have the big parties. Let us not go to the rage and the raves. And let's do the right thing.
Let's do the right thing. That was public health medicine specialist Dr. Lehlohonolo Majake chatting to us about the 10% that will be the first batch of people receiving the COVID-19 vaccine when it finally gets to South African shores sometime next year.